Starwood Equine is a full-service equine ambulatory practice with locations in Woodside, California, and in the East Bay. We pride ourselves in providing comprehensive veterinary care and health management services for your equine partner and athlete. Thank you for accessing our online educational resources. Check back often as we will continue to update the site. First and foremost, thanks everybody for coming tonight, joining us for, what is it, our fifth, who knows at this point in time, webinar, but we're excited to have found sort of this opportunity to continue connecting with everybody and to close out what was third in our series of educational seminars with MHA. I suspect it won't be our last. We are obviously more than happy to team up and do more, but we're excited that even though we weren't able to meet in person, we were able to keep this going. So for those that we have not had the opportunity to introduce ourselves to yet, we are Starwood Equine. We are a 5-doctor veterinary practice that services both the peninsula and also now the East Bay. And we're excited tonight to have the opportunity to talk to you about complementary therapies. So tonight we're sort of taking a team effort. Dr. Wright will be representing the chiropractic component with her International Veterinary Chiropractic Association certification. Sue Novick, our registered veterinary technician, just actually this month received her certification through the Equinology Equine Bodywork program. So congratulations to Sue. And I am kind of closing it out with the rehabilitation side. I received my equine rehabilitation certification from the University of Tennessee 2 years ago now. We want to give a special thanks to Metropolitan Horsemen's Association for teaming up with us to provide these educational events. It's super fun for us to get to connect with people, to answer all of their questions, and just to kind of make some connections. So thanks for all of you that are in the association that are joining us, and also to the board and Rachel and Joan for really helping us get the ball rolling with it. I will also say right now, I don't have access to my chat. So if there's questions, Cara or Sue, if you can help me to moderate, thank you. So the outline for our talk tonight, we're going to start with a focus on complementary care, specifically chiropractic, acupuncture, and bodywork. We'll go into a little bit more detail on some of the treatments that we include or offer through Starwood, and that you might hear your veterinarian talking about. And then we'll close out with rehabilitation. And we should say that I should also say prehabilitation, meaning that we're going to give you some tips and tricks for things that you can be doing now that will actually help to prevent injury.
Okay, so I'm going to take over. For those of you I haven't met, my name is Cara Wright. Nice to see you on here. So essentially when we talk about complementary care, we are talking about looking at the whole horse, as opposed to looking specifically just at one body system or one issue. So I know, human medicine, we go to the internist or the dermatologist, but in veterinary medicine, we see the whole horse, and then adding complementary care such as chiropractic, acupuncture, and these other therapies, we're really trying to address all of the imbalances and anything else that we see, nutrition and everything, just to get the whole thing, the whole horse happy and feeling good. So the balance is key. Like, obviously there are some things that Western medicine is, if you need antibiotics, you need antibiotics, but you also could, potentially laser a wound and get some really good increase in healing, or acupuncture a colic and get some pain relief. So there's a really good balance of all of these things working together. And then the disclaimer for all of these, that is just so important. And I would caution you, because there are a lot of people that have a lot of toys out there. Just be sure if you think that there's a real problem that you get a diagnosis, because some of these therapies and treatments are actually contraindicated in certain instances. So diagnosis and knowing exactly what's wrong is really important. And then it's really a great way to be able to pull in everything to get a resolution. So I'm going to start by talking about chiropractic. Like Kelly said, I have my certification from the International Veterinary Chiropractic Association. I got that in the UK in 2018. So chiropractic is not, you can go ahead and switch it, Kelly. Thank you. It's not cracking backs, and it's not putting a bone back into place, which I know is kind of what, we're like, oh, my neck is out or my back is out. But if it was actually out, then you would not be standing. So it really is ensuring the correct function of the joint. So not only the spinal joints, but also the joints and the limbs. And essentially, I've got a little diagram here, and you can see, the skeleton. We've got the cervical, the thoracic, the lumbar, the sacrum, which is right behind the pelvis, and then the coccygeal, or the tail vertebrae. And I'll tell you, the most common places that I see issues in horses are going to be the lumbosacral area and the pelvis, and then the lower neck. And that is simply just because of what we ask them to do. But again, so chiropractic, we're trying to ensure correct function of the joints. And when we say correct function, I want to know, is there pain? Is there change in its movement, or is there change in the muscles or the responses that are supposed to be happening in that area? So the way that I do that, on the next slide, you'll see is, it's called motion palpation. And basically I go through the whole horse and I feel all of the joints and I move them in all of the directions that they are supposed to go. So if you're looking at this screen and you see the vertebrae that we're looking at, there's the part sticking up, the spinous process, and then the two wings. Thank you, Kelly. And so essentially that whole thing should move in its appropriate range of motion. And when I feel it, sometimes it will move a little bit in the right way, just not the whole way. Or sometimes it will only move one way and not the other. So it could be fixed out of neutral, it could be fixed in neutral, or it could be stuck in the middle and not moving at all. So when I'm doing my initial exam, I am feeling all of these joints to see, are they moving in their appropriate range of motion? If they are not, then I do an adjustment to try and encourage it to get back to where it's going. And then on the next slide, you will see the reason that this is important. If you look at the diagram at the bottom, there are, it's a spinal nerve. You can see it poking out. And essentially, if you imagine those spinal nerves are little highways of information. So they are sending information from the brain out through the spinal cord and through the spinal nerve to the foot, the muscle, whatever. And then they are sending signals back from that all the way back up to the brain. So if that little spinal nerve is compressed or not moving the right way because that vertebrae is not moving the right way, then there's going to be a lack of signal to and from the brain. And so nerve signal dysfunction can show as muscle weakness, muscle tightness. Sometimes we see muscles shaking. There's also an inflammatory response, which we see as pain. And then also when there is that altered joint motion, that's when you can see other things compensating. So I don't know if you've ever seen a horse that might have, like if you're looking at them straight from the back and, one side of their gluteals is nice and round and then the other one is kind of flat and concave. That's an example of a muscle that is not working properly. So let's figure out why, because it could be that those nerve signals are not traveling and telling that muscle what it needs to do. So some of the things that I see, or I guess the things that clients see that then they ask me to come evaluate the horse, muscle imbalance or atrophy, weakness or lack of soundness. So not even an overt lameness, but sometimes just my horse can't pick himself up, or he's not picking up his leads, or he's just lacking impulsion behind. Sometimes we do see overt lameness, decreased performance, kind of just what I said, they're just not quite feeling right. And then sometimes we do see muscle pain and fasciculations. So chiropractic is sort of the first thing we're going to address. So if you have any questions about that, please feel free to put them in the chat and we will get to them after.
Thanks, Cara. So Cara referred to, some lack of function within the nerve signals themselves, and also just the inflammatory process. And I think you'll notice that the theme is that as we present to you all of these different modalities, they have a common general goal in mind, and that is obviously to provide pain relief and to make sure that all systems are functioning appropriately. So acupuncture is similar to chiropractic in its end goal. It just works a little bit differently to get us there. It is a traditional Chinese medicine that's been in use for over 2,500 years. And the way that it works is by stimulation of predetermined locations we call acupoints along 12 different pathways, and you'll hear people call those meridians. It was originally thought that where those needles are going, or those acupoints, actually all involve nerve bundles. I mean, you think about acupuncture, you think about we're activating nerves. With more and more research and dissections associated with those acupoints, we're finding that they don't necessarily have an actual nerve associated with them. But what we are finding is that the meridians that we follow, sort of the channels or scans that we do, follow fascial planes. And so the fascia is like the connective tissue within our system. And so the moral of the story is we don't know exactly how it works, but we know that there's an association with the fascial planes or connective tissue in the body, and the nerves are in some way associated as well. Common treatments or conditions that we can treat include arthritis, behavioral issues. There's some calming points that we can use, or points to help with fear responses. We can also help with that muscle weakness that Dr. Wright discussed. If we see a horse that's really lost some of its muscling, and we find that there's maybe some associated lack of nerve function, we can help to actually stimulate those nerves to start firing more appropriately. It can be helpful with head shakers or horses suffering from allergies, and it can also be used in GI support, like the colic that Cara referred to. This is a quick video that I'll show you that sort of shows the preliminary parts of an acupuncture scan. You'll usually see us using just a needle in our hand, or something that's kind of blunt and gives us just a little bit of extra localization. And we scan through the meridians all the way down both sides of the horse's neck, back, and gluteal region. And you might see that this horse gives a little bit of reaction as he's being scanned right through sort of the mid cervical region. You can see his ears kind of come back. He's questioning that area. So when I'm doing my preliminary evaluation, I'm going to get a history from you with what's going on, but then we'll go through and actually do these scans to try to determine if there's particular regions that are extra sensitive to your horse. Once we identify those, or we learn your particular concerns, our objectives can be followed, and really they're control of pain, control of the allergies or other clinical signs that you might be concerned about, resolution of those muscle fasciculations, or like the shaking of the muscles that you might see, and then also that neuronal regeneration or improving of nerve function. You'll see a lot of different types of acupuncture available, and this is sort of human or horse. There's dry needling, like the bottom left picture, where just a dry needle is applied in multiple locations. In the top right corner, there's an example of electroacupuncture, where we're actually trying to stimulate those channels or meridians to sort of open them up and get a little bit of a better flow or communication. Aqua acupuncture or hemoacupuncture involve injection of either medications or actually the horse's own blood to try to keep a stimulus there a bit longer. So once the needles are out, we're no longer stimulating that area, but if we leave a little bit of a liquid, then it sits there and kind of is a more long-term stimulus. And then there's also laser stimulus. So you might have a needle shy horse, and we do find that sometimes that they're very sensitive, and we can't safely apply needles, and so we can actually use the laser to stimulate those points along the way.
All right, so along the same lines as all of the other treatments here, we have very similar goals, and we'd like to take a holistic approach that includes all of the other team members that support this horse, trainers, the owner, the veterinary team, the farrier. We like everyone to be involved to get the best history and the best outcome for this horse. It's definitely an approach that is most beneficial when it's part of a team approach. It doesn't replace veterinary care. We're not going to be solving issues. We'll just be supporting the horse, which helps owners achieve their goals. There's a lot of different schools of thought out there, different programs that you can go through and become certified in. As long as there's a good educational component in there, they're all beneficial, but it's just important to have that history. And the goal is to restore functional muscle length. So it can be of use to almost all horses in some aspects, whether they're in a lesson program, they're, a senior horse who doesn't really have a job anymore, but might have a little discomfort. And depending on the individual situation, it's always a good idea to get a treatment approved from your veterinary care team prior to starting a new treatment, just to make sure it's the best, choice for the situation. And then most programs have a very good educational component, but there are people out there, so be aware of theatrics. If you poke a horse, almost every horse will respond. So they should respond to gentle stimulus, so don't be startled. An important point to remember is we are working with the horse. We're not just working on the horse. It's really a partnership between the body worker and the horse to achieve those releases of their muscle and their training. We like them to lean into the process and kind of use them as a guide to what areas need worked on and how they feel in the process. It's a communication method. And so we are trying to get them to go through their full range of motion, kind of like Dr. Carr was mentioning with chiropractic, just more for muscle tightness. And every horse has their own normal. So we take that into account based on, the past history, injuries, their level of training, what their goals are, and that's why the team approach is so important. So when I start a bodywork session, I like to evaluate the horse using the 4 T's, which are tone, texture, temperature, and tenderness. So I move through the horse's body, checking for any, unusual muscle tone. Is it very tight? Is it, tighter on one side than the other? Are there any different textures in that muscle group? Is there a tight line of fiber? Is there scar tissue present? Do you feel any holes in the fascia that Dr. Kelly was referring to? And then kind of your general, is there any heat or swelling? Is it cool compared to the other side? So we look for temperature differences that can often indicate unusual areas. And then is the horse reactive to the touch? Is it bothered? Is it resentful of the palpation? That's another thing to look for when we're doing the body work. And the goal is to locate and release tensions and restrictions in the body, return the muscles to their full functional length so they can go through their range of motion. It can be used to increase blood flow and reduce fatigue, so it can help aid in recovery from a tough training session or show schedule. It can increase range of motion and stride length, according to one paper that's come out, but a lot more research needs to be done. And then it also has pain relieving qualities. So let me know if you have any questions at the end of the session.
Okay, so just wrapping up those first 3 things. So again, like we said, none of these therapies are intended to be a replacement or the end of the road treatment for anything. Again, just like Sue said, it's a team effort, owner, trainer, farrier, everybody, to get these horses feeling good and doing their best. But again, the major benefit of these therapies is being able to look at it from a little bit of a different angle. And so I'm going to go into describing some of the other treatments that we sometimes use depending on horses' injuries or situations. The first one is called the shockwave. I don't know if anyone here has ever seen it or used it, but essentially it is a big machine that uses sound waves to stimulate healing. There's some really good data out there that it can be good for suspensory ligament lesions and also pretty good for wound healing. And basically what it does is it sends sound waves into the body that are essentially, they are sound waves outside of the body, and once it gets in there, they are a pressure wave. And that is something we adjust on the machine based on the location and the problem that we are treating. That it's actually really interesting. They discovered that the shockwave was good for certain bony problems in human medicine when they were treating kidney stones in humans. And when they were looking back at their imaging, they noticed that the pelvis area near where those kidney stones were treated had an increased bone density. So then they started looking into it. And essentially the shockwave can increase blood flow and promotes growth of new tiny blood vessels in an area. So it can be really good for something, a wound or, an injury that's been stagnant and not really changing. Sometimes you can use the shockwave to sort of wake it up and encourage it to kickstart itself. And it also can increase the production of natural healing factors, which kind of goes with the blood flow. Like it kind of wakes everything up and tells it, all right, get it together, time to start healing up. Shockwave actually also produces some local analgesia, some pain relief for a couple of days post-treatment. So it is now actually banned on the racetrack on the backstretch, and it's also not supposed to be used at horse shows because of that. Horses also do need to be sedated because it does make a really loud cracking noise. And it also, if you've ever done it on yourself, it doesn't necessarily feel great. It feels good after, but during, it's not the most comfortable. So again, there's some pretty good data for suspensory ligament lesions, and it also can be really good for deep back pain. So that's the shockwave. The next tool in our little toolbox of therapies that we will talk about is the laser. So the laser uses light as opposed to the shockwave, which uses sound. The light can be, there's many different classes of lasers, different wavelengths, different strengths, different focal points and such. So we're going to be talking about class 4 medical lasers. These are the ones that can actually be dangerous when used improperly because they are strong enough that they can burn tissue, and they can like be bad for your retinas if you look directly at them. So it is important to make sure that if you are around somebody that's lasering, that you have on your safety glasses, or that you stay a reasonable amount away so that you don't accidentally get lasered. There's a lot of good data coming out with the laser. I really like to use it on some of the chiro patients that are very painful and I can't really get good motion through anything. The laser encourages a reduction in pain and inflammation, and it also feels warm and relaxing to them. And a lot of horses, as you laser them, they will start to get a droopy lip and a droopy eye. The other thing that you can do with the laser is it will speed up the healing of wounds. I used it a lot on that, I guess, the practice I was at before I came here. There was a lot of horses running into fences. So we used to laser a lot on a lot of really big wounds, which can be really nice because I'm sure you know that having a non-healing wound or a wound that you've been bandaging for months can be very draining. And as Dr. Zaytunian said, you can also use the laser to stimulate acupuncture points. So again, the laser uses light as opposed to the shockwave, which uses sound, and they both stimulate different parts of the cell for growth factors.
So the final therapy that we'll talk about is mesotherapy. And to me, this first looks like it has angel wings. It's like Pegasus. I don't know. It doesn't give the horse wings, but it does definitely help with pain relief. And so mesotherapy works by the gait control theory of pain relief. And that is a tongue twister, but to put it in layman's terms, we essentially overwhelm the very smallest kind of branch or leaf of the nerve highway, and we stimulate it with a numbing agent and sometimes just saline, just something that actually creates such an overstimulus at the nerve at the nerve ending that it gets to the point where it basically just turns off the signals. The brain is overstimulated and it just shuts down. And why we want to shut it down is if there's this chronic pain cycle, if you've ever had a sore back or just an area that's painful, the tendency is to kind of crunch and crunch and crunch to try to compensate for that pain response. And it's like a snowball effect. Just gets worse and worse because you start to sort of tighten up, and then it's even harder to sort of loosen and lengthen the muscles, as Sue was describing. So mesotherapy helps specifically in the neck and in the back, as you see in the video on the photo on the left, just to try to stop the pain spasm cycle. It's teeny tiny little needles that are inserted just into the skin layer, and you'll actually see these blebs form. So this horse was obviously quite back sore and being treated just to try to get things loose enough and softened enough that we could actually do some manipulations and some chiropractic work on him. So that's mesotherapy in a nutshell, but you'll most commonly see it used on the back and on the neck.
So I'm going to briefly touch on a couple of other therapies that are used fairly often. The first one is the pulsed electromagnetic field. So a CC loop you might have seen, or the Beamer blanket. And essentially what that is magnets being used to change the cell membranes and how they transport ions through them. Nobody really likes cell biology, so we won't talk about it that much more. But essentially there is some good data from the FDA in humans for using a CC loop for non-union fractures, so for broken bones that are not healing back together. You can see some pretty good short-term pain relief for mild back pain in horses, but there is some data out there that that this therapy can actually delay healing in tendon lesions, so lower leg stuff. So just be cautious if you think that that is part of your horse's issue, not to use that if you think that's the case. But it does have some pretty good results for some mild back pain. And again, the FDA has approved it in people for non-union fractures. Another thing that we see a lot of is vibration therapy. It's more common sometimes in some of the small animal therapeutic programs because it's a lot easier to have it in your clinic. But essentially what it is a giant plate that shakes the horse. And there's some data about, does the horse shake up and down, or is it better to shake side to side? But essentially, the whole point of this is to work some of the small stabilizer muscles. UC Davis did a study that showed actual hypertrophy of a muscle called the multifidus, which is a muscle in the back that attaches the vertebrae to each other. Showed hypertrophy or growth of those muscles after use of a vibration plate. There also is some data that says for horses with a mild lameness, they actually can feel better for up to 30 days of treatment. But after 30 days of continuous treatment, there actually was a decreasing amount of soundness. So the vibration therapy can be helpful, but definitely something not to overuse, but definitely a couple times a week or that sort of thing can be helpful. I'm going to touch on very briefly some of the magnetic blankets or ceramic blankets and boots. Essentially, horses seem to like them. You can't hurt your horse with them. And anything that makes horses feel relaxed and happy, I feel like is totally acceptable. So keep on back on tracking with your horses. So again, moral of the story with any of these therapies is try and have a diagnosis. You just want to make sure you're choosing the best combination of things to use for your horse. And then again, for sure, another disclaimer, some of the ones that we talked about, such as the laser or the shockwave that stimulates cellular metabolism, would absolutely be contraindicated in certain cases, such as a pregnant mare. There's no data anywhere that says you should be using any of this stuff. Not necessarily acupuncture and chiro, but any of the cellular changing devices. Horses with cancer, you do not want to stimulate cell growth, so you would not want to use something like a laser in that. So again, that was sort of a really quick summary of all these things, but if you have questions, let us know and we will get to them at the end. We will move into some of our rehab exercises now with Dr. Kelly.
Thanks, Cara. Yeah, so I think we wanted to end with this rehabilitation discussion, and I should also call it prehabilitation, because we hope to not get to the point where we are needing to use all of the different modalities to treat an injury. Rather, we want to work with you and give you some tools to prevent these injuries from occurring. Another study that UC Davis recently came out with looked predominantly at footing in horses and its association with injuries. And one thing that they found that I felt was the most important takeaway that I like to share with trainers, owners, riders is the best thing that we can do for our horse is cross train. So if you look at, human athletes and Olympic athletes, downhill skiers, they're not just downhill skiing all day long and practicing that over and over again. They're doing a lot of different exercises that help to strengthen and stabilize every part of their body to be conditioned for success. So we realized that, as we're sitting here meeting on this webinar and most of us stuck sheltering in place, this is a great opportunity for us to give you a little bit of homework and give you some exercises that you can start to initiate now before there's an injury. But certainly these are we have exercises and things that we can give you specifically to given weaknesses or injuries as well. So, we've kind of said to you a number of times, there's so many options out there, and knowing what to use and what's best to use is really difficult. So the practice of equine rehabilitation helps to just look at the whole picture of the horse, the severity of the injury, how long ago it happened, what your goals are for the horse's future use, and I think really importantly, what you can manage from a time and financial component. And we look at all of those things together and try to help you to pair together, what modalities are going to give you the biggest bang for your buck and the best response. Our end goal is to restore mobility, reduce pain, and recover the normal joint environment. And so in a rehabilitation exam, it's sort of just a combination of all of the other exams we've told you about. So we're looking, we are doing, if I can get the video to play, we're doing sort of the scan similar to what we do with an acupuncture scan, and that's what you see here. I'm looking to see if this horse's response to that stimulus is normal function. We are also doing some mobilization of the joints to see what their horse's range of motion is, etc. We watch the horse being taken, through walk trot on the lead. We mobilize its different joints to see range of motion, as I said, and then we'll also watch under saddle just to kind of get a really good sense of how this horse is being used and what work they're doing. And then we can come up with some plans for you. And so this is the homework that we're going to give you. There's a million different stretches that can be really beneficial for you to use with your horse. And I personally like to have the horse sort of warmed up before asking them to go through these stretches. If you go to try to touch your toes, before you've gone on a walk or a hike, it's a lot harder to do than once you've sort of loosened up and after. So for me, a lot of these recommendations, let your horse walk around and loosen up a bit before you do it. But we'll show you an example here.
Show you the chin to chest stretch. The idea behind that is that we're going to get nice flexion through the upper and middle cervical region. So you'll let them know that you have a cookie and ask them to give you a nice flexion right to the center of their chest. As they get better and more flexible, you'll encourage them to come even further down towards their sternum.
So that was a stretching exercise, just trying to lengthen those muscles and loosen everything up. And then this is an example of a strengthening exercise where we're actually trying to engage and recruit the horse's muscles.
The last exercise that we'll have you do is called a pelvic tuck. And what we're asking them to do is really engage through their pelvis and reposition it with a nice tuck. You want to check this and be careful when you're first starting, just in case the stimulus creates a kick response. Where you're going to go is right behind on either side of the tail head. And again, you're either scratching or have a brush handle or something a little bit irritating to ask. And then you're just going to give them a little bit of a rub, asking them to tuck through their pelvis during the pelvic tuck. So we're going to
so this horse is better.
Example of those tucks. So again, before you do it, make sure that the horse is not going to kick out when you ask them to do this movement. Just try from the side first before you get directly behind them. And then when you ask, you're just going to go on both sides of the tail head and give a gentle massage and ask them to tuck through their pelvis. So you can see, we'll do a couple times to see that movement. Just getting a nice tuck, holding it for a few seconds, and then letting them relax. And then we'll also show you from directly behind so that you can see the nice movement and hand placement. Getting a nice tuck, holding it, and then letting them relax.
Okay, so those were just two example stretching and one of strengthening exercises. There are additional stretching and strengthening exercises available for you on the Starwood YouTube channel, and the link is here, and I think Sue's going to try to put that in the chat for everybody if you're interested. We will be adding more and more of these pieces of homework for you all to start and start implementing them now. You don't need to wait until your horse has an issue to use them. Use this as that cross training that we talked about. I also think we felt that it was important to give you some options that were either in-hand options or, non-jumping options. I know there's a lot of different sort of regulations in place at the various barns, and many people are choosing not to jump just for the safety reasons and trying to just kind of reduce their risk of ending up in the ER. So there's a lot of work that can be done using poles to really help with that strengthening and engagement, and really just kind of taking a little bit of a different or new approach to your exercise. And so the picture on the right shows these uneven poles. And we sort of set, every other and then the same on one side. The idea is to just stagger the poles and stagger the height and which side you're asking the horse to move on. The idea behind this is that we're working on the horse's proprioception. So that's basically them knowing where their feet are. I liken this uneven pole exercise to like the football players going through the tires, asking you to kind of raise your feet and jump through. I personally don't know that I would be able to do it very well right now, but I think that it's something that we can practice. And it's a lot of work, though it might not seem like it is. So the videos that we'll share are an example in slow motion of a horse working through these uneven poles. And you see, so I want to say this is a Grand Prix horse. This is a horse that has been showing. At the time that we took this, he'd been showing all season. You'd think he'd be pretty fit. You'd think if he's going to be jumping 5-foot jumps, he knows where his feet are, or you'd hope so. And he had quite a bit of difficulty working through this particular exercise. So the strength is there, but the fine motor skills are somewhat lacking in his case. He did finally get it together though, and here's a slow-mo where you can really see the engagement and just how much we're asking the horses to reach and how much more motion we're getting through both their forelimbs and their hind limbs. So really great exercise, keeps you from jumping, but keeps the horse really engaging those muscles. And so that's our homework that we're giving you. And the other thing that we'd like to do is invite you to some of the upcoming webinars that we have scheduled here in the next couple of weeks.